For the first time, the Utah Department of Health releasing information on hospital bed and ventilator usage. The Hospital Association says the numbers are concerning. ABC4's Brittany Johnson joining us now live in studio with the newly released data. Brittany.
Well, Glenn, Utah's hospitals are about 2/3 full, but not just with COVID-19 patients. Now, that's according to the Hospital Association. And as we see the rate of infection increase, it's possible the number of hospital beds needed will increase as well. The question tonight, are Utah's hospitals ready for a possible influx? For the first time since the COVID-19 outbreak, we're getting a look into the number of people in bed and on ventilators throughout Utah's hospitals. 61.9% of the state's intensive care unit beds are occupied. 50.5% of non-ICU hospital beds are filled as well. And 197 of the state's 1,298 ventilators are being used. We called Greg Bell, president and CEO of the Utah Hospital Association, to get some insight into the numbers.
I would say the hospitals are concerned, but not alarmed. Our COVID patients are only taking about 11 to 12% of the beds. The rest of those patients are heart attacks, transplants, trauma, kidney failure, the normal intensive care unit patients.
Bell says hospitals are about 2/3 full, but not with COVID-19 patients. But if Utah's hospitals did reach capacity, Bell says they would utilize auxiliary ICU facilities.
We have extra vents, we have extra beds that are properly outfitted, with all the equipment, the oxygen, et cetera, et cetera. But at some point, obviously, you can outstrip the staff, you can outstrip the facilities. So we need to be careful. This is a wake-up call.
The rate of increase has been on a steady rise for 2 weeks.
It shows that we're not doing the precautions that we need to do to contain this disease.
Bell says to stop infection, vulnerable populations need to stay home. People must practice social distancing and wear masks in public. It's important to note hospital numbers are a lagging indicator. The numbers are a week to 10 days behind actual infection. Now, the reason for this, I'm told, if someone does get infected, they usually don't go to the hospital right away because their symptoms aren't as severe as in the beginning. Glenn, back to you.